So an endoscopy generally is not painful. I would describe it as an unpleasant procedure, partly because the camera is going down your throat and you may experience some gagging. The things we do to try and mitigate or avoid this from happening is to spray the back of the throat with a local anesthetic spray so that the gag reflex is numb. And a number of patients will have their endoscopy with just the local anesthetic spray and tolerate it without any problems whatsoever. The alternative would be to have the throat spray and also to have a light conscious sedation. So this is where a small tube is left in the vein, which is introduced through a needle, and we give medication through this tube to make patients slightly drowsy and sleepy for their procedure, just to add to the level of comfort. So an endoscopy procedure normally takes anywhere between 6 to 10 minutes. On the day of the exam, you would be met by members of staff, and they will go through the procedure with you and just go through a checklist to ensure that it is safe to continue. They may ask you about your preparation before the procedure, and to ensure that the preparation is adequate and there's no reason for us not to proceed on the day of the examination. Once the examination starts, it's usually completed within that 6 to 10 minute period. Sometimes there may be a slight increase in that time depending on what the findings are, but usually during this period patients are relaxed and slightly drowsy to make it as comfortable as possible. So in general, you will be sent information about preparing for your endoscopy before the procedure. This usually involves remaining nil by mouth, for example, not eating anything for a period of 6 hours before the procedure as a minimum. You can take sips of water for up to 2 hours beforehand if instructed to do so. We will often ask if you are taking any specific medication beforehand and would like to know about these. In particular, we are worried about the use of drugs which may thin the blood, such as clopidogrel for your heart, or blood thinning agents such as warfarin, or some of the newer agents such as rivaroxaban, apixaban, edoxaban, or dabigatran. So these medications need to be stopped in advance of procedure. We also want to know about some additional antacid therapies such as omeprazole, lansoprazole, pantoprazole, or esomeprazole. If you are taking these and it's for a follow-up procedure to check for healing of any inflammation or ulcers, then it is safe to continue. But occasionally we would like patients to come off this for a period of 14 days prior, so we can check for specific bacteria in the stomach at the time of your procedure. So a gastroscopy is a safe procedure and serious complications are very rare. Most commonly, patients will experience a slight sore throat after the procedure just for where the camera has passed, but this is generally short-lived. There may be some bloating from the air that's put into the stomach because of the fact that we need to distend the stomach to see what we are doing. And this again is usually short-lived and settles within a few hours of the procedure. The serious risks of bleeding, infection, or very, very rarely a tear in the food pipe, stomach, or the small intestine is extremely rare and is considered to be less than 1 in 5 to 10,000. So in general, we explain to patients that a gastroscopy is a very safe procedure. The only other things we sometimes mention is that there is a very small risk that you may have an adverse reaction to the medications we use, or very rarely damage to the teeth from the mouth guard which we use to protect the mouth and to protect the endoscope. But again, this is extremely rare. So recovery from a gastroscopy or an endoscopy is relatively quick. Your results are given to you at the same time after the procedure. It may be that your clinician will ask for you to be booked to follow-up because you may be sedated at the time and not remember all of the information that is provided to you after the procedure. Generally, you will be asked to stay in the hospital for a period of up to an hour afterwards, just for the effects of sedation to wear off before you are discharged. If you have had the throat spray, then we normally recommend not eating or drinking anything for the first 45 to 60 minutes afterwards, as the throat may still be numb. Once you are home and you've been discharged from hospital after that first hour, for the first 24 hours, we often explain to patients that they should not drive or operate heavy machinery. They should not take sedatives or drink alcohol, as there may be an interaction with some of the sedation given at the time of the procedure. And we often suggest not signing any important documents or taking any important decisions, just in case the conscious level is impaired as a result of the sedation that was used at the time of the endoscopy.